Welcome to the AARDY.compare.com YouTube channel for travel tips. I'm Jonathan Breeze, the CEO, and today's topic, United Kingdom Travel Health. Well, at AARDY Compare, we look at a variety of different information sources in order to get a better view of a country and its health systems. So two great resources are the CDC and the US State Department, and here's their advice. Firstly, vaccines and medicines. All travellers should be up to date on routine vaccinations while travelling to any destination. Now, some vaccines may also be required for specific travel, so make sure you are up to date on routine vaccinations before every trip. And some travellers may also need additional vaccines and medicines based on where you are going, how long you're staying, what you'll be doing, and if you are travelling from a country other than the US. Always best to check with your doctor. Now, some other vaccines your doctor may suggest for your trip include for the following: hepatitis A. So hepatitis A outbreaks occur throughout the world and sometimes in countries with a low risk for hepatitis A, which includes the US and the UK. You can get hepatitis A through contaminated food or water in the United Kingdom, so talk to your doctor to see if the hepatitis A vaccine is right for you. Moving along the alphabet, we have hepatitis B. Now, you can get hepatitis B through sexual contact, contaminated needles, and blood products. So the CDC recommends this vaccine if you might have sex with a new partner, get a tattoo or piercing, or have any medical procedures whilst on your trip. Now we move on to rabies. Well, rabies is present in bats in the United Kingdom, however it is not a major risk to most travellers. CDC recommends rabies vaccine only for travellers involved in outdoor and other activities in the remote areas that put them at risk from bat bites, so such as adventure travel and caving. So if you are off to Wookey Hole Caves, then this might be for you. Otherwise, you might want to avoid it. Or of course for people who will be working with or around bats, such as wildlife professionals and researchers. So in terms of medical care, it is worth noting that whilst medical services are widely available and free medical care is available in the National Health System in the UK, this is for UK residents only, certain EU nationals and some visa holders. So an NHS surcharge is assessed on certain visa applicants at the time of application, and tourists and short-term visitors will not be assessed the surcharge but will be charged 150% of the cost of any medical treatment they receive from the NHS, and unpaid balances of £1,000 or more can result in being barred from a return to the United Kingdom, so be aware that US Medicare does not apply overseas. So what our recommendation is to carry prescription medication in original packaging along with your doctor's prescription. Be aware that certain prescriptions available in the United States are classed as narcotics in the United Kingdom and are not available. And finally, invest in some travel insurance. Now, we love Amazon and are fans of Expedia, so comparison shopping is simple. Sites like AARDY Compare do exactly the same for travel insurance, and you won't find the same trip insurance plan available at a better price. This is down to price certainty, which is guaranteed as a result of anti-discriminatory insurance laws. Safe travels.